While the news of possible emergency authorization for the new COVID vaccines is widely viewed as a huge step in the right direction, there are still many hurdles, from refrigeration to transportation and distribution to rural areas, that state healthcare officials are currently trying to sort all out. Joining us now to discuss the distribution plans for his state is Alabama State Health Officer Dr. Scott Harris. Dr. Harris, thanks so much for joining us. Curious to get a sense of, in the last 14 days, certainly your state has recorded more than 43,000 positive COVID cases. You have said that you expect, quote, dark days for the foreseeable future. Give us a lay of the land on the state of COVID in Alabama right now, and also what your biggest challenges are still ahead.
This is a very challenging time for us. Alabama is seeing the greatest number of hospitalizations than we have ever seen during this response. We're seeing daily new cases in numbers higher than we've ever seen before. We have not seen deaths at quite the same rate that we had in the summer, but we're certainly concerned about that given the recent Thanksgiving holiday and the fact that our deaths seem to lag by 2 or 3 weeks after we have these big spreader events. So but we have a lot of concerns going forward into December and into the rest of the holiday season.
And let's talk specifically about distribution. The Pfizer vaccine, which is the first one that your state will receive, has intense refrigeration requirements. So what's the plan to get this vaccine to rural areas that may not have a nearby hospital or the refrigeration capabilities needed?
Yes, we actually have hospitals in our larger areas that have agreed with us to work on distribution in their own catchment areas. If we look at about a 40-mile radius around those hospitals that do have the capability to store the vaccine, we can reach around 80% of our phase 1A population. That certainly isn't everyone, and that's certainly not sufficient. For those parts of rural Alabama that don't have the ability to easily obtain that vaccine, we're going to need to wait until at least the next week in order to have the Moderna product. That shipped in much smaller allotments and of course doesn't have the same cold chain requirements. We wish we did not have to wait an extra week to reach some of those areas, but logistically that's the best solution we've been able to come up with.
And of course, staffing is a major issue in multiple states. Alabama is no exception. How are you filling in those gaps when it comes to who will be providing and injecting these vaccines?
Yeah, so the hospitals have played a major role there, and then we will also be using county health departments. We will also be using other community-based providers, places like pharmacies, doctors' offices. Now, those professionals, those frontline healthcare professionals, are actually in the target population as well, and so we want to get them immunized as quickly as possible. But then they certainly will be the ones who are turning around and reaching out to those folks in their own community to continue that vaccination process.
Now, public trust is, of course, a big issue when it comes to vaccinations. Alabama, in particular, has the historical stain of the Tuskegee experiments. And for our viewers who may not be familiar, in the 1960s, it was uncovered that for decades, the U.S. government had been deceiving a group of 600 black men to believe that they were being treated for a disease known as bad blood, when in reality, they were actually being used as guinea pigs for a syphilis vaccine, which resulted in health complications for some and even death. As you may know, Dr. Harris, this has contributed to a broken trust between some in the black community and the healthcare system. What kind of outreach has been done to educate black people in Alabama to reassure them about the safety of this vaccine?
Sure. I would say, first of all, we absolutely acknowledge that the historical mistrust that we see has been well earned in a lot of cases. I mean, to put it mildly, we certainly understand and recognize why black Alabamians have concerns about the vaccine, and really the whole partisan atmosphere we've been in for the last several months in this country, have not made that any easier for everyone. We understand that in order for us to have credibility, we need trusted voices within the African-American community to be the messengers. And so we have, for many months now, been working with faith organizations, black pastors organizations, with African-American legislative leaders, as well as local public officials, and many others who we have been trying to educate on the process and help them to come to having some level of confidence in the vaccine, as we ourselves in public health have seen the evidence and come to have confidence as well. Ultimately, we're going to need these local officials who have personal relationships with individual people in our state to be the ones who are willing to encourage people to do it. We know that their voices are trusted and heard and respected in a way that, a government entity may not be, particularly here in a state with a history that we have.
And lastly, what's your biggest concern about the long-term impact of COVID on your state? And do you wish that measures like stay-at-home orders or mask mandate would have happened sooner?
Yeah, I think we all understand that there are certain things that seem to reduce disease transmission, but politically it's been very difficult to get support for that and to get buy-in on that. Our state is really divided on that, just like many other places have been. I think that the long-term consequences really show some of the same fundamental problems that Alabama has had for a very long time, even pre-COVID. You know, we have a significant disparity in the number of deaths among Black Alabamians compared to everyone else, even though Black Alabamians don't get infected with COVID any more often than we would statistically expect them to. COVID has really just revealed another health disparity that we've always had. We continue to have these differences in outcomes with things like cardiovascular disease or infant mortality or cervical cancer, many other things. And now we're just seeing it revealed again with COVID. But we still have areas with poverty. We have places where access to care continues to be a challenge. And unfortunately, COVID hasn't taught us any new lessons about that. It's just revealed the same ones we've recognized for a while.
Dr. Harris, thank you so much for your time and coming on the show. We appreciate it.
Thank you for having me. I appreciate it.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.